Good afternoon, sir. So for today, I am performing the integumentary assessment. So the first thing to do is you have to identify first your patient. But before that, you have to introduce first yourself to the patient so that at least the patient will know your name. So good afternoon, ma'am. I am Rochelle Pasion, your student nurse. And you are Ashley Lynn Villanueva, right, ma'am? So after identifying your patient, also you have to ask some of her personal informations, but you have to make sure that her personal informations will be confidential. Also, you have to ask some questions that will may help you in assessing the integumentary parts of the patients, like any past skin disease or problems, ma'am? Or are you using skin care products, ma'am? Or any changes in your skin, ma'am, or pigmentation? So those questions will help you in assessing the patient. So after identifying your patient, if appropriate, ask the patient if it is okay to change your clothes into examination gown. And if since we do not have an examination gown, we will be using her usual clothes as long as you can inspect or assess her thoroughly. Also, you have to ask for her consent if it is okay to touch some of her integumentary parts so that there will be no problem in the need of assessing her. So after that, you have to ensure that the curtains and doors are closed so that there will be no problem in her, and to prevent her comfort and to give her some privacy. Okay, so after that, you have to perform hand hygiene for your to prevent contamination. So after performing hand hygiene, the first thing you do is assess first the skin of the patient. You have to inspect the overall coloration of the skin of the patient. So let's see. Okay. So skin color is very important because it may reflect the overall health of the patient. For example, if the patient has yellowish color, it means that the patient has jaundice. And if the patient has a bluish color, it means that the patient has cyanosis. And if the patient has pale color or pale skin, it means that the patient has a pallor. And if the patient has a reddish color, it means that the patient has erythemia. So the next thing to do is you have to inspect if there are vascularities, bruises, or bleedings present in the patient's body or skin. Okay. If vascularities, bleeding, or bruises present in the patient's skin, make sure to take note their sizes, their shapes, their colors, their proportions, how big they are, how small they are. And after that, also you have to inspect if there are lesions present in the patient's body. So let's see if lesions are present. Okay. So you have to take note if lesions are present, like scratches, cuts, wounds, mosquito bites, and if some of those are present, you have to take note also their sizes, their shapes, their colors, their proportions, and etc. So after inspecting if there are lesions present in the body of the patient, you have also to palpate the temperature of the patient by using the back of your hand or your dorsal part. So take note that you should not use your palm because there is less vascularization present in your palm. Okay? So after that, okay, let's see, ma'am. So, it is important to palpate the temperature of the patient so that you will know how warm the patient, how cold the patient, or how hot the patient. Okay? So, after that, you have to also palpate the texture and the moisture of the skin of the patient. So, let's see. Okay. So, the patient has an abnormal findings if there is excessive moisture or excessive dryness. So, if the patient has an excessive moisture or excessive dryness, it means that the patient has an abnormal texture and moisture. So, we have to take note those findings. And after that, if after palpating the texture and the moisture of the patient, also we have to inspect or assess the skin turgor of the patient by pinching the skin under the clavicle over here. So it is normal when the skin pinch, it turns back right away to its previous state type, and it is abnormal when the skin stay pinched or tented, or it did not turns back right away to its previous type. So we need to take those findings. Also, we have to inspect for edema if there are swelling present in the patient's skin. So let's see. Okay, if edema is present, we have to use ruler or tape measure in order for you to measure how deep the edema is. Okay, and after that, after inspecting if there is edema present or anasarca present in the patient's body, let's move in assessing the nail of the patient. So when the patient has a flat nail angle, or has the angle of 180 degrees or 190 degrees like this, it means that the patient has clubbing. And if the patient has a spoon nail, also the patient has an abnormal nail angle. So we need to take those findings. So after inspecting if if clubbing or spoon nail present in the patient's nail, let's also palpate the moisture, the texture, and the capillary feel of the patient. So, we need to see if the patient has a soft texture of her nail, it means that the patient has normal texture. And also in the capillary feel, in order for you to palpate the capillary feel by using your two thumbs, by pinching it, and then separate it like this. Okay. It is normal when the color pink of the nail, or the usual color of the nail turns back to its previous type less than 4 seconds, and it is abnormal when the usual color delayed in returning, or there is delayed or in returning the color pink or the usual color of the nail, that it may indicate circulatory impairment. Okay, so after assessing those, let's move in assessing the scalp and hair of the patient. So the normal findings in the hair and scalp of the patient when there is no infestations present in the patient's hair and scalp, like lices, and also when there is no lesions present in the patient's scalp, and if lesions or infestations present in the hair and scalp of the patient, make sure to wear gloves for your hygiene. Okay, the patient also has a normal hair or normal findings when the patient's hair is thick, and also there are no brittleness found or present in the hair. Also, you have to see if dandruffs present in the scalp of the patient, that may indicate two abnormal findings. Okay, so after inspecting the scalp and hair of the patient, if you are wearing gloves, make sure to remove it and perform hand hygiene. And after that, you have to document all your findings. That's all, and thank you.